Earlier today, I did an interview with Calgary ER Dr. Joe Vipond about the Scientific Advisory Group of Alberta Health Services, and I'll put the link to that interview in the YouTube description for this interview so that I don't have to repeat it all over again. But basically, there is a debate over the science between how COVID-19 is transmitted. Is it the old science of droplet and touch contact, or is it the new science of airborne aerosol transmission? So then I was curious, how do these science advisory groups within provincial governments, how do they work? How are they composed? What do they do? So I'm going to talk to Professor Patrick Fafard, who's he's a professor in the Graduate School of Public and International Affairs at the University of Ottawa. Welcome to the interview, Patrick.
Thank you very much for having me.
Look, you're an expert in this area, and one of the first things that comes to mind is when you've got a dispute between scientists, there is really no one the science, is there?
No, we learned early on in the pandemic that if you ask an epidemiologist, a virologist, a general practitioner, and heaven's sakes, maybe a behavioral scientist or an economist, questions about the pandemic and what the policy response would be, you're going to get many different answers. And so while governments will say, we are getting the best available scientific advice, it makes an enormous difference which body of scientists, and even within different scientific specialties, who they're talking to, because not surprisingly, people do not agree.
Okay, so in this particular case, there is a fair amount of disagreement between the proponents of the old science and the new science. So I take it that the composition of an advisory group is very important.
Indeed, it is. My colleagues and I did some research years ago on scientific advisory committees in general. And what we discovered is that different governments are all over the map in terms of how they constitute them, what decision rules they use, how they handle dissent and disagreement. And what we've experienced during the pandemic in most Canadian provinces is no different. And another key difference is, do we actually have a window on that scientific debate or not? So in some provinces we do, like here in Ontario, it's quite public. Whereas in other places, either they're not named or the government is not quick to reveal them. And so it's hard to kind of figure out exactly who's on them and what difference it makes.
How important is the recommendations from a science table or a scientific advisory group? I mean, does it have a fair amount, quite a bit of influence on public health policy?
Let me give you two contrasting views. The short answer is yes, but it makes a huge difference how we think about it. So there is this sort of conventional rationalist view that we would like our governments to follow the scientific evidence and develop policies that are based on the best available science. And if the world were simple, that would be great. But in fact, the world doesn't work that way. And that's because even if the science is fixed, which it's not, government policy is not based solely on the science. And I would go further and say, nor should it be. There are too many considerations that need to be brought to bear when a government makes huge decisions about how to manage a pandemic. And so it's kind of naive to think, and it's not even desirable to think, that it would be simply whatever the scientists tell us to do. And then, of course, then there's the prior problem that I mentioned, which is, of course, the science is not fixed, it changes, and different scientists disagree on what the best course of action is.
Now, I interviewed Professor Trish Greenhalgh, from Oxford the other day about this very question. And she said that around the world, it's quite common for orthodox views to become entrenched in public health bureaucracies, in scientific advisory groups. So her argument is that the old science around transmission of COVID-19 is dominant around the world. That's quite common. Would you agree with that?
On this particular question, she is among the most knowledgeable and expert people in the world. So I think we should listen carefully when she speaks. But what she alludes to is something that is a bit broader. That is to say, the problem of orthodoxy. Scientists are like human beings, right? They develop a certain worldview and they move off it with reluctance because it's potentially quite challenging. And there are two examples. There are many examples, but I can name two. So there's the one you mentioned, what to do about the fact that the virus is airborne as opposed to spread by droplets. The other good example of that is masks or not masks, border control. Early on in the pandemic, it was conventional wisdom among public health experts that you don't move quickly to close your borders because it doesn't make that much difference anyway. Turns out, when you look into it very carefully, that was a generalization based on modeling. And then boom, the COVID pandemic happens and we don't need model anymore. We have real-time empirical evidence, and that view needed to shift. And it did, but it took several months. And so it's not at all surprising that there's a lag effect. Unfortunately, in a pandemic, you would want things to move much more quickly than they typically do.
Given the fact that we have 10 provincial governments of health and 3 territorial, is it surprising that we would have some scientific advisory groups and their governments moving more quickly and others would be laggards in adopting new science?
Yes and no. There's a premise to your question, and that is that we have real life, that the choices the governments make are a reflection of the different science or the different bodies of science that they're following. That may or may not be the case. Having said that, yes, absolutely. There are significant differences between provinces in how they bring scientific evidence to bear. The conventional model before the pandemic was, and it was the model that had been used, is that in 7 of 10 provinces, all except the 3 biggest, the chief medical officer of health was to be the bringer of the science. We appoint a public health expert, a medical doctor, and he or she is meant to be the point person for bringing to bear on government deliberations about what to do, the best available science. In 3 provinces, BC, Ontario, and Quebec, there is now and has been for many years, especially post-SARS a decade ago, public health institutes. So in Ontario, we have Public Health Ontario. In BC, it's the British Columbia Centre for Disease Control, and there's a similar agency in Quebec. In all 3 cases, what we discovered was those agencies, while they were the conduit for a lot of science, the pandemic demonstrated that neither of those institutes or the chief medical officer of health were big enough, strong enough, robust enough to be the only bringer of the science. And so government scrambled in the spring of 2020 and on almost ad hoc kind of basis created new mechanisms to channel the best available science into government. Sometimes those committees are very public, as it is here in Ontario. In other cases, they're much less public, or if you know where to look on a website, you can find it. And you have found much about how it works in Alberta. But there's a couple of other things about those committees that is important. More often than not, they're very local. That is to say, you assemble some combination of epidemiologists from your local university, maybe some people from your health department, in some cases from your health authority. And that's all good because they work really hard and they try and come up with a consensus. But there's no consistency necessarily on the mix of people with a background in modeling, people with a background in virology, epidemiology, et cetera. And so depending on who you choose and depending on the decision rule they use, you get different outcomes, which is not, remember, we're doing this in real time, on the fly, very quickly. So the good news is governments are working really hard to try and go out and get the best available science. The challenge is that the mechanisms that they're using are variable and they're not as rigorous as we might want them to be.
Given where we're at in Canada, Patrick, and I think specifically of Alberta and Saskatchewan, just today, the Canadian Medical Association issued a press release basically saying that the 2 provinces, the healthcare systems are collapsing under the weight of COVID-19 infections. So I think we could ask the question, is the public health, are there mechanisms, are the policies, are they working, and the role that science might or might not be playing in that process that kind of led to the problems they've got now?
That's an excellent question that we're not going to be able to answer in the short term. In the inevitable and necessary postmortems, as we look back and say what went right and what went not so right, one of the key questions will be the structure of science advice. How did it get built? How did it get structured? There is a view out there, much less common in Alberta, but present in some other provinces, that that's exactly what the Public Health Agency of Canada was meant to do. Be one single place where the best available science is brought to bear. But of course, that was what some people recommended after SARS and is a view. But I don't have to tell an Alberta audience that the idea that some group of scientists on a pan-Canadian basis would be the basis of advice to the government of Alberta is not something that makes a whole lot of sense, given the realities of Canadian federalism, but also because, and this is critical, the science advice is but one input into what governments choose to do. And what we would want to avoid is somehow, the National Science Advisor structure has said the government should do thus and so, and an expectation that all the governments would fall into line. That's unrealistic, it's undesirable. So I would hope we never go there. Nevertheless, we could do a much better job, province by province, of how we construct and design the science advice, particularly in doing crisis management around a pandemic.
Then it probably wouldn't surprise you to learn that the scientific advisory group around AHS has never done a review of the droplet versus airborne aerosol transmission issue, but Public Health Agency Canada did, and back in April, and it doesn't appear that review has been looked at by the scientific advisory group or acted upon, though that may be the case, and maybe there's just nothing in the public record that I could find. But nevertheless, you probably wouldn't be surprised.
I'm not surprised, but nor am I particularly concerned. If you take a simple model that the only science input into the decisions by the government of Alberta is this table, or this table to the Chief Medical Officer of Health and then on to the government, yeah, that might be a concern. But the practical reality is that we have a we have a bureaucracy, a system to make sure the cabinet makes the most informed decisions possible. So the cabinet advisory system is there to assemble all sorts of inputs, including homegrown ones like the science advisory table that you mentioned, but also you get your evidence and your advice wherever you can get it to paint a complete picture. So whether or not a given province did or did not do a systematic review of the available literature on aerosols versus droplets doesn't concern me, simply because, as you said, many of these reviews exist. The question becomes, did that debate, did that difference of view factor into the decision-making by the government? We don't know, because it's all done privately. Ideally, we would hope it would. But it would be a mistake to have this one-to-one relationship. In the age of Zoom and the internet and instant Google searches and a proliferation of scientific evidence on what could and should be done in a pandemic, governments don't lack for scientific input. They've got lots. Now, one of the roles of these scientific advisory committees is to systematize, think through, balance, and ideally come to consensus. But even there, just because one group of scientists have cobbled a consensus doesn't make it right. It just means one group of scientists came to a consensus. So here in Ontario, we had a case a couple of weeks ago where the science table, which is very sophisticated, very public, was delaying providing advice on what to do in schools. And they thought for good reasons. And one of the members of the committee, in a very loud, celebrated way, resigned from the committee, arguing that somehow politics had gotten involved. At some level, this is not surprising. Scientists disagree, and that's kind of as we would want it. What we do want to avoid, though, is the suggestion that somehow politics gets messed in with. I mean, we do want the decisions to be based on political considerations, just not in the science advice system. So they got into that problem in the UK. But in Canada, by and large, from what I can see, these science advisory things are working as they're intended. The flaws are not politics. Their flaws are selection of members, decision rules, transparency, and as you suggest, ability to incorporate new data and new information as it becomes available.
Patrick, fascinating insight into a world that most people don't even know exists. So really appreciate your insights. Thank you very much.
You're very welcome.